So this is a challenging area for respirologists. So pulmonary fibrosis is diagnosed often later than we would like it to be diagnosed, and that's because the initial symptoms are very nonspecific. Patients will often start having some shortness of breath that they might just think is age-related. They may have a cough as well, and there are lots of different causes of cough, many of which are more common than idiopathic pulmonary fibrosis or other subtypes of pulmonary fibrosis. And because of those nonspecific initial symptoms of shortness of breath, cough, and generally fatigue, patients often are treated or investigated for other cardiac and other pulmonary causes first. And once those are found to not be the cause, then patients will go on to more detailed testing, including CT scan, pulmonary function tests or breathing tests, as well as sometimes blood tests and biopsies and other things. And then that's how patients are eventually diagnosed. One of the other challenges is that patients are often misdiagnosed at the beginning and are given a diagnosis of one type of pulmonary fibrosis, but in fact they have a different type. So it's fairly common for patients to be given a diagnosis of idiopathic pulmonary fibrosis, for example, and then upon further evaluation by an expert in the area or just with additional time to follow how things have progressed, then they're led to a different diagnosis. So I'd say about a third of the time the patients come to me with a given diagnosis of pulmonary fibrosis. We change them to a different diagnosis altogether. But just to answer that question more briefly, it's a combination of the patient's symptoms, physical examination, blood tests, breathing tests, CT scans, and sometimes biopsies.